Hello and welcome to Joint School. My name is Narinder and I'm one of the pre-assessment nurses who work at Spire Leicester Hospital. The presentation will give you an overview of what to expect for your joint replacement surgery and how we will support you on your journey for a successful recovery. The presentation will be delivered by myself, pharmacist and a physiotherapist. We will go through the preparation for your surgery and post-op care. I will also go through the preparation for your procedure, and pharmacy will talk to you about your medicines and pain relief, and the physios will discuss your exercises and recovery. Before your admission, we would require you to complete an online questionnaire. So at the bottom of this slide, you'll see something called patient reported outcomes, abbreviated PROMs. You'll need to register for this. So you go online, put that web address in, register your details and complete a 15-minute questionnaire. By doing this, this information will help us to ensure you receive the best possible care and allows your consultant to monitor the progress of your recovery. So I'll leave it up there for a minute so you can write down that web address. Okay, so the nurses are here to make sure that your journey with us is smooth, that you're safe, and that you're well cared for. So we're going to support you throughout your stay in hospital, and we'll be just a phone call away for when you return home. The physiotherapist will help you regain function through exercise and enable you return home safely. So they'll teach you how to walk with your new joint on the stairs, on the flat, give you exercises, make you confident. So by the time you leave here, you'll be happy. You'll also meet various other staff members here at Spire, such as the resident doctors, housekeeping, and theatre team. And we are all here to support you throughout your stay with us, and we'll only be a phone call away. So the joint replacement surgery is to help improve the quality of life and relieve pain. So the damaged bone is removed and replaced with a prosthesis. Now, this prosthesis can be made up of a combination of materials such as metal, ceramic, and plastic, but your surgeon will discuss the exact type that you will be having. The wound will be closed with some clips, which look similar to staples, and you will have a dressing over the top of this. Before you leave the hospital, we'll give you an appointment to come back to outpatients approximately 10 to 14 days post-procedure to have these clips removed. Now, it's a good idea to have a bit of pain relief before you come for this, as it can be a little bit uncomfortable having your clips removed, but not painful. So it just kind of covers you for this. I would like to talk about the National Joint Registry now. They work for England, Wales, Northern Ireland, and the Isle of Man. And what they do is record details of all patients having joint replacement surgery in order to prove patient safety and monitor surgeries. So the National Joint Registry are there to help surgeons choose the best artificial implants, empower patients by enabling them to find out more about the implants that they're having, improve safety of patients, and give feedback to hospitals about their performance and help them improve patient care. They will contact you some weeks after your operation to ask you questions on your recovery and record this information. If there's any issues, then they'll pull up your records and investigate. Now, these are the forms, as you can see on the slide, that you'll need to sign on admission. This will then prompt the NJR to contact you at home and so they know that you've consented for this. So we advise patients to keep the body warm. This helps with recovery and reduces the risk of infection. So if you feel cold at any one time during a stay with us, let us know. I will ensure your room is kept nice and warm and that you've got the extra blankets that you need. So just let us know. And keeping hydrated is essential. as this improves your recovery and avoids unnecessary complications. So if you're not drinking enough water, then you must start to increase your intake. If you're dehydrated, even mildly, it can make you feel sick post-anesthetic. So imagine having strong anesthetic medicines combined with an empty stomach with dehydration, it can cause vomiting. Being dehydrated can increase complications such as blood clots in the lungs or the leg. It can also cause post-operative confusion and falls, kidney damage, and post-operative infections. So as you can see, it's really important to keep hydrated. Another aspect to consider is constipation. Now, this can occur due to reduced mobility, and opioid-based drugs can have a sluggish effect on the bowels. Keeping hydrated and taking adequate exercise will help with this. Your diet should be balanced and contain whole grains, fruits, and vegetables, and fiber should be increased gradually to avoid flatulence and bloating. So I want to show you this slide. So you're probably thinking, well, how much water do I need to drink? So if you look at this slide, number 1 to 3 shows you what color your urine should be. So if it's around that color, then you're fine, you're keeping hydrated. Anything darker than that, the higher the number, it shows that, yes, you need to increase your intake. So that's kind of a guide for you, really. Okay, so I would like to talk about complications now that may occur. There are many factors that can increase the risk of blood clots. However, admission into hospital and surgery for whatever reason has been shown to be a significant risk factor. When you're at home recovering, if you find you get pain in the calf, heat, redness, feeling generally unwell, and excess swelling, you will need to call us and we will advise you what to do. However, if you start to experience shortness of breath, chest pains, feeling generally unwell, you'd call an ambulance, as is much more serious. Now, these are just the worst case scenarios, and the reason why we're telling you this is so you know if you experience any of these symptoms, you know which course of action you would need to take. Another complication during your surgery would be there'd be possibility of increased blood loss, in which case we may need to give you a blood transfusion. Now, we would not give you a blood transfusion unless this was absolutely necessary. The pre-assessment nurses will discuss this further in a lot more detail in your assessment. On admission, you will need to sign a consent form for this, and I'll show you what that looks like on the next slide. Eating foods that contain iron and a varied balanced diet should normally provide the adequate iron intake that you need. So this is a form that you'll need to sign on admission, but the nurses will pre-fill this in over the telephone for you or in your face-to-face appointment. So before your procedure, you'll need to come in for some tests. When you have your assessment with the nurse, they will advise you about this appointment. You'll also have some blood tests, and these bloods will check for anemia, check your kidney function. We'll do an ECG, which is a heart trace, to make sure your heart's beating in the normal fashion. And we will do some swabs to check for bacteria such as MRSA, which is methicillin-resistant Staphylococcus aureus. Now, when you arrive for your tests, we will provide you with information leaflets about your joint replacement surgery. We'll also give you a leaflet about the National Joint Registry and information about blood transfusions. Please do read through these booklets. They provide excellent information about your surgery, recovery, and exercises. They're very informative. In preparation for your procedure, you will be required to use a body wash to help reduce the risk of infection. So you need to use this 5 days prior, and you wash your body once a day in this body wash. It's an antimicrobial body wash, and we'll provide you instructions on how to use this. You'll also be required to use this nasal ointment, and you apply this to the inner surfaces of both nostrils twice a day for 5 days. This will help decontaminate the nasal passages from MRSA, and this reduces your chance of getting post-operative infection in your skin or in your wounds or in your joint. So both together helps reduce this risk. What I would advise is for you to do a patch test of this solution, both solutions, on your skin. And if you don't react, great, carry on using it. But if you get any sensitivities, then you would need to call us so we can find something alternative for you to use. We will provide you with our numbers.
Hello, my name's Navida. I'm one of the pharmacists that work at Spy Leicester. I also work with the pre-assessment nurses. I'm going to talk you through some aspects about the medication during your stay and afterwards. I'll also mention other aspects of your stay. My first slide will talk through items that we recommend that you bring into the hospital. So the first thing on my list is we ask that you come in with all your regularly prescribed medicines. We ask you to come in with them in their original boxes. We ask that those of you that use Doset boxes or compliance aids where you fill out pill boxes, not to bring your medicines in like this, but to ask the pharmacist to give them to you in the original boxes. We also ask you to come in with any eye drops, any creams, ointments, liquids that you use, or any inhalers. We prefer you to come in with the most recent dispensed medicines, but if you do use when required medicines, don't worry, bring them in. Just make sure we can see an expiry date on the boxes. Okay. Ideally, the team checks your medicines with you within 24 hours of your stay. It would be useful if you could come in with your repeat slips from your GP. Okay. The next item on my list is if you stated you have an allergy, we ask you to collate some information about this allergy. What was the drug? What happened? How quickly did it happen? And has it been verified by your GP or an allergy clinic? Again, this is because if we're going to give you medicines that are not our first choice, we need to make sure it's for a justifiable reason. Okay. The next item on my list is the admissions pack that gets sent to you. We ask you to come into hospital with it. We'll have some useful leaflets about your joint replacement, but also there'll be a booklet. When the anaesthetist talks to you about the type of anaesthetic he or she will be using, also if we discuss the type of pain relief you're having, it just gives you a bit of background information and you'll feel better informed. Okay. Also, the physios would like me to remind you, you're very welcome to come into the hospital with any walking aids that you're used to at home. They will assist to rehabilitate you back onto those walking aids, as well as give you additional items. These walking aids from home may be the right dimensions for your home and the right height for you. So again, don't feel you can't bring them in because we can help you with them. Okay. There's been evidence suggested that if patients are kept warm pre-surgery and post-surgery, they recover well, they heal better. So we ask that you come in with plenty layers of warm clothing, typically for your stay and just a few extra just in case. Narinda's mentioned about the Optanistan lotion that you'll be using on your body. Another way that we make sure that we reduce your risk of infections, we ask that you don't shave the area that needs to be operated on. If that area needs to be shaven, the theatre staff will do it with your consent. Again, it's just so that you don't cut that area and accidentally, then there's a chance of you getting an infection. Okay. Another thing to mention is that we do recommend you come in with something to entertain yourself, whether it is a book, an iPad, some crossword puzzles. Just to remind you, your to come in time is not your operation time, so there is a bit of time for you to be waiting in your room, and then there's an opportunity for you to catch up with a book that you want to read or to use your iPad. Okay. The last item on this list that the physios want me to remind you about is to come in with suitable footwear that they can use when you're having your physiotherapy post-surgery. They ideally would like you to come in with shoes that have a rubber sole with a good support around the heel, and also something that has which is made of a material that's got a bit of give in it. So no new shoes, and we find that trainers are as good as anything. So again, just think about the footwear that you're going to come into hospital with. You can bring in your slippers as well. It's just the footwear that you're using when you're having your physiotherapy. Okay. Just move on to the next slide. So this slide is about the Dorset boxes and the compliance aids we don't want you to come into hospital with. As you can see, even if you bring in loose blisters, we ask you to come to hospital with them in the original boxes, so we can cross-check the name and cross-check the expiry and batch numbers. And reasons behind not coming in with the Dorset boxes is sometimes post-surgery we may have to miss out certain tablets, for example a blood pressure tablet, and it's really difficult for our nurses to identify those tablets because manufacturers' colours and shapes do change. So again, just don't bring them into the hospital. Make sure you come into the hospital with the original containers. This slide's about the day of your operation. So before you come to the hospital, we ask that you do take your regularly prescribed medicines in the morning prior to coming in, if you normally do so, unless your pre-assessment nurse, after your consultation with her, indicate that you're not to use that medicine on that particular day. For example, certain people that take certain blood thinning medicines may be asked not to take their medicine on that morning, but it all will be dependent upon that discussion with your nurse. In addition to having fasting time cut-offs, you'll also have hydration cut-off times. This is generally 2 hours prior to your come-in time on your letter. In addition to this, we would like you to measure out 200 mils of water, and we'd like you to drink that water before you get into your transport to come into the hospital. This is, again, to reduce your risk of clots, and also we'll have a rough idea when you last had your drink. Make sure this isn't busy water. Okay. We ask you to arrive at our green reception, which is the admissions reception. We do have another reception for the outpatient department, and that's the red reception. So you need to go to the green admission reception and check in at the reception, and then a member of the team from the ward will come down and escort you to your room. You'll have an opportunity to unpack, familiarise yourself with the room. There'll be an air conditioning unit in there, but we ask you not to reduce the temperature too low, because again, we'd like to keep you warm prior to your surgery. It will be in this room that the anaesthetist will come in and discuss the type of anaesthesia you'll be having with your procedure. Generally in this hospital, most patients will be having a regional anaesthesia, which again is listed in the book, in the booklet if you want to familiarise yourself with it. It's an injection into the spine, and it takes a couple of minutes to work, and it lasts 2 hours. Most of our patients have this because there's good evidence of good recovery, less nausea and vomiting, less operation time, so it reduces your risk of clots, and it's good for people with certain health issues. Some patients may be listed for a general anaesthetic, and again, that's when you're not awake, and again, the anaesthetist will discuss this with you. Those that have a spinal anaesthesia are awake. They can hear and see what is going on in theatre. Some patients prefer to not hear, so they bring in headphones to avoid hearing what's going on. Right, so after your surgery, you spend some time in the recovery suite. When it's safe to do so, a nurse will escort you back to the ward. What I do have to mention after surgery is that everybody experiences some pain, but what we need to say is we are aware that everyone's pain is very individual. How we've all treated our pain can be very individual. So we will prescribe regular pain relief, but we also will put additional items on your medicine chart. So if you felt uncomfortable or the pain is you're not tolerating the pain, we can add additional items to assist your recovery. We will ask you to grade your pain 0 to 4, 0 being no pain, and 4 being excruciating pain and you don't want to be there much longer. and will work with you to move that pain level down. We also have a white buzzer next to you, near in your bed next to you, and all the members of the team would expect that will be close to you, and you can press that buzzer if you need to get our attention if you're feeling uncomfortable. So please don't hesitate to press that buzzer when you're in your room and you felt uncomfortable. Okay. Also, when you're back in your rooms, it's really important that you rest, but there are some exercises that you can attempt while in your bed, and those exercises will be shown at the end of this presentation. Also, some of you may have come back out of theatre wearing stockings, compression stockings that help the circulation in the leg, or you may be attached to a boot that's attached to the bed that makes a noise and it sends intermittent pressure up and down the leg, again to increase the blood circulation in the lower limbs. This is all about reducing your risk of clots. It's quite specific to your consultant, so if your consultant wants you to wear them, he'll request that with the nursing staff. Okay, and it's quite normal that your leg will feel swollen and a bit heavy. This is why it's very important you do not attempt to get out of bed, because of the numbness and the lightheadedness from the anaesthesia. So we expect that our patients that need to go to the bathroom to press the buzzer, and the nurse will come to you with the bedpan. So please don't feel embarrassed about that. All our patients are the same. This slide just talks through the typical type of medicines we may be sending you home on discharge. Again, it all depends what medicines you've been using while you've been on the wards. We would send home roughly about a week's supply of medicines, and if you needed further supplies, we ask you to go to your GP so it can be managed carefully. We would send home some paracetamol. We would also consider sending home a mild opioid, something called codeine or dihydrocodeine. Because the codeine or dihydrocodeine can have a sluggish effect on the bowels, we'd always send you home with something like a lactulose and a senna, a laxative. In addition to a paracetamol codeine, if you can tolerate anti-inflammatories, we would send home something called ibuprofen or naproxen. Again, to minimise the potential of that irritating your tummy lining, we would consider prescribing something called lansoprazole. The bottom two items on this slide are additional pain relief that we may send home if you were experiencing difficulty in managing your pain with the above items. So the oral liquid morphine is a fast-acting liquid morphine. We would only send home a bottle of that, and then we would be expecting you to be able to manage your pain relief with the above items. The last item on this list is something called Nefapel. This is a very good medicine for post-operation pain, and again, we typically send home a week's supply. In addition to pain relief medicines, we would also be sending you home with a course of medicines to keep your blood nice and thin. It could be an anti-platelet medicine like aspirin, or it could be an injection called Fragmin. But this will be discussed with you on the ward, and it would be a course that you would have to complete even at home. And again, that's all to reduce your risk of clots. When we come to see you on the ward, the pharmacy team will discuss your pain relief. They'll discuss the medicines you're going to be taking home. In addition to this discussion, we would generate a medication guidance sheet specific for you, and it will list the medicines we're sending home, what they're used for, the typical doses, and we would give suggestions of times a day to take them and some additional information as well. So we will reiterate what we are sending home again on this guidance sheet.
Hello everyone, my name is Charlotte. I'm one of the physios from Leicester Spire Hospital. Here what I'm going to do is take you through the next few slides to talk to you about the physiotherapy side of things and what to expect about discharge and being at home after surgery. So when you do come in, you will be admitted onto the wards. One of the physiotherapists will come and see you to talk to you about any questions that you have before you go down for theatre. Now, it could be that you're admitted at 8 o'clock in the morning, 7 o'clock in the morning, or you're admitted at 12 o'clock. You are all different here, but we will see you before you go down for surgery. Another thing that they will come and do is teach you how to use elbow crutches. Now, majority of you will be using elbow crutches when you get discharged and on the wards. So what we do is try and teach you how to use them so you're familiar for when you do come out of your surgery. You also have the opportunity here to discuss the exercises with the physio, what you should be doing after your surgery in terms of the exercise program. So you will go down, you'll have your surgery, and what we will do is we will come and see you after your surgery to try and help you get up and start walking after surgery. Now, depending on what time you do go down and what time you come back after surgery, depends on when the physiotherapist will come and see you. The majority of the cases, we will come and see you the day after surgery in the morning, and we'll help you to stand up and get walking again. Now, the day after surgery is a long time from when you do have surgery to when we come and see you. So what we try and encourage is that you are all moving inside of the bed. And what I mean by that is that you're bending your knee and bending your hip up and down and getting it moving before a physiotherapist comes and sees you. Now, this is very important, of course, because of the circulation, to prevent any DVTs. And of course, you're going to be getting stiff whilst you're laying in bed waiting for the physiotherapist to come and see you. So you must start moving your knee, moving your hip straight after surgery. But that does not mean get yourself up and out of bed. So please do call on the nurses if you do need anything. And then, of course, if it's too painful to move, then please let the nurses know, because they can give you painkillers well in advance before you have any physiotherapy. Because what a physio will do is they'll come see you after surgery and they'll say to you, let's get up, let's stand up, and let's walk a short distance. Now, we want your pain to be well controlled before we come and see you. So a physio will come and see you. They'll ask you to sit on the edge of the bed. They'll ask you to stand up. They'll ask you to start putting weight through that hip, putting weight through that knee. 99% of the cases here we have on the wards, you can all fully weight there through this hip and knee joint, depending on what you're having done. So please don't feel that you can't put any weight through it, but what will stop you is because you'll be in a degree of discomfort. Now, again, if that is too much, we need to be telling the nurses that you're in too much pain. That's how we're going to get you moving. We're going to give you some more medicine to help you cope with putting some more weight through that joint. So what we do expect is that you're self-washing, dressing yourself after surgery, you're moving that knee, moving that hip, and of course, when you do need to get up out of bed, one of the physios or one of the nurses is with you to help you mobilize straight after surgery. So please don't expect yourself to be walking long distances after surgery. We will only want you walking as much as you can tolerate. Everyone's different when they get admitted here, so we will base it on your level of fitness. So some of you may be only walking short distances straight after surgery, and some of you might be walking quite long distances after surgery, depending on your own level of fitness. And what we're aiming to do is to get you to an ability to be able to manage being at home. So what you all need to start considering is when you do get home and having some support at home. So when I say some support, I mean that you might need someone to pass you things, you might need someone to make you meals, you might need someone to help you make a drink. Because after having this type of surgery, you will be very fatigued. And those things that are quite easy right now will be quite difficult after surgery. Your body is getting over a major joint replacement, so you will need some support. Now, if that worries you at all, then you do need to tell us before you come in, because we need to put things in place about care, aftercare, before you come in for surgery, okay? So it would mean calling on friends and family to just be popping in to you when you do get home. So what we do expect that You'll be up and walking after surgery, using elbow crutches, walking short distances. If some of you live in a house, we will practice stairs with you before you coming after surgery, sorry. If you live in a bungalow, then of course we would only expect you to do short distances. If you have a step inside of the house, we will show you how to do the step. So this is just a slide to remind you about calling your buzzer. Now you will all have a buzzer beside you in your bed, in your chair, for when you need us. So what we do expect from you is that you are calling us whenever you think you need us. So after surgery, you can feel quite dizzy because of all the anaesthetic and the medicine that we give you. So we don't want you walking independently without anyone beside you for whilst you're in hospital until a physio tells you that you can actually do that. So we need to double check that you're feeling okay before you're getting up and being independent on the ward. So what we ask is that you call your buzzer for whenever you need anything. So we call it call, don't fall. So as I say, discharge. So when it comes to going home, everyone's length of stay is quite different depending on your own circumstances. So I would advise that you all think about a possible 1 night stay to a 3 night stay, depending on your own capability, depending on your own home circumstances. So having that lift ready to come pick you up whenever you do get informed of a discharge time and day throughout your stay here. So your nurse will be able to inform you of your discharge time and what to expect. You will have a full medication guidance, is what is previously spoken about, before you go home. You'll have a written plan of all the discharge medicine, so you know exactly what you should be taking after surgery. You will also be told before you go home about all of the outpatient appointments that you need to come back in and see us for after surgery. For those of you who are having a hip replacement, you will be given a toilet raise, a grabber and a shoehorn, because we know that the people that have a hip replacement, it is quite difficult already to bend over. So we give you a shoehorn to help you with putting on shoes, we give you a grabber for picking things up off the floor, and we give you a toilet seat raise because toilets tend to be a bit lower down. But all of you need to consider when you do get home, any kind of extra aids that you might think about to make things easier for you for when you get discharged. So what we do expect is that you are self-washing for when you go home, but it could be that you're not in a shower straight away. So because of your confidence levels, so it could be that you need a chair in your bathroom so you can sit down and then you can self-wash and self-care for yourself. It could be that you need an extra grabber in your shower just to help you with confidence after having a hip or a knee replacement. There are things that you can get online, such as this sock aid, to try and help you with bending over and putting on your own socks. So do consider those type of things, that you will be in it with elbow crutches when you get home, and you may need some extra help, especially those people that live alone. There are things out there that will help you to make things easier for when you do go home. So please consider who's going to do your shopping, who's going to make the meals, who's going to do all those cleaning jobs for when you get home. Okay. So what we expect when you do get home is for you to do the exercises that we give you 3 times a day. We want you to move as what feels comfortable, to avoid any sudden or sharp movements. So the consultant won't want you pushing your pain too much. So if you're having a hip replacement, we do want you moving as whatever feels comfortable for you. So the consultants will say avoid bringing your knee up to your chest and not to push the pain too much. You can sleep in whatever position is comfortable, both for hips and knees. Usually what we recommend is putting a pillow in between your knees if you're having a knee replacement, to make it more comfortable. And if you've had a hip replacement, you can lie on your good side, put a pillow in between the knees just to give you an extra bit of support. So please don't think you have to lie on your back when you do go home. Driving, you are unable to drive for the first 6 weeks after surgery. And please don't get in the car until you feel completely safe enough to perform an emergency stop safely. Bathing and showering, as I previously said, you will have a waterproof dressing, but please don't soak the area with the shower head. But you are able to have a shower, of course, but you all have different scenarios. Some of you have a shower over the bath, and some of you have a walk-in shower. What I would do is have a think about, if you do have a shower over the bath, having a chair in the bathroom. So until your confidence builds, you can sit and have a strip wash for those first few days, maybe up until a week, until you're able to use the shower properly. If you have a walk-in shower, then great, you can get into that shower. You may want a non-slip mat on the floor just to make things a bit more secure for you after surgery. There are key things that you need to remember before you coming in. So please let us know if you're feeling well prior to surgery. Please keep hydrated. So aim for 2 litres a day. Please drink a glass of water, 200 mils before you leave. Now the nurses will discuss this for you before you come in. Keep mobile. So generally the fitter you are before surgery, the better experience you're going to have after surgery. You will have been given lots of items to read through. Make sure you read through everything that you're given, because a lot of questions can be asked through that information pack. And make sure that you bring in your regular medicine in with you when you come into hospital within the boxes and not in a Dosset box. Okay, so I'm going to show you a video now of someone that has had a replacement already. Now this gentleman is 2 days after having a hip replacement. So we'll just talk with you and go through with you the scenario here. So he is 2nd day after having a hip replacement. He is doing his exercises in the bed as instructed by the physio. This is typically what the rooms look like. On the left there, you've got the ensuite, so that's where your toilet is, and on the right there, that's where you've got phone facilities, etc., for if you need to call one of your family members. So I'll just let this video play. This is how you'll be getting up after your surgery. So this is just more exercises that we expect you to do after your surgery. Now, as I've said before, everyone's got their own capability. So it could be that you're not doing these exercises straight away, but we will be instructing you to do them as soon as it feels comfortable to do so. So this is just an example of how you're going to be walking with your elbow crutches after surgery. And this is how you're going to be doing stairs. So a lot of patients say that they're really scared about doing stairs after surgery, but the majority of people say to us, that wasn't as bad as I thought. So we will go through this with you. Usually going up the stairs is your good leg first. You're holding onto a banister and you're bringing the elbow crutches up with you. But please feel reassured that we'll be doing this with you when you're on the wards with us. So just as a reminder, please, if you're having any concerns about your aftercare and how you're going to cope, please call the physiotherapy department as we can go through this with you. And please mention it to your pre-assessment nurse as well about how you're going to cope after surgery. We look forward to seeing you when you come in. Thank you.
I hope this has been helpful, and thank you very much for listening to me. And I wish you the very best for your joint replacement surgery but we'll be here to support you throughout the whole process.